So I was at summer camp for marine biology, and I happened to look in a graduate school course book, and I saw genetic counseling, and it spoke to me because it is a combination of the hard science of genetics and the person-to-person interactions of patient care. Hi, my name is Sara Cherny. I'm a genetic counselor in the Heart Center at Lurie Children's. As a genetic counselor in the Heart Center, I care for families with heritable cardiac conditions. These could be arrhythmias or heart muscle conditions. They can do with cholesterol or structural heart disease. And what I do is help families understand how genetics may or may not affect their child's care, help them navigate the genetic testing process, understand genetic test results. One thing that is unique to cardiac genetics is that we have a lot of variants that are uncertain. And a big part of my job is doing variant analysis, spending time to look at the literature, look at databases and scientific studies that have been done about a particular gene to determine if a particular variant is actually associated with a condition or not. We understand that not all genetic conditions present in the same way. Each person, even within a family, might be different. And so part of our job is to gather as much information as possible and not miss anything, not just for the child in front of us, but for their relatives as well. And that's stepping through the family one person at a time to find out if they are or are not at risk for whatever genetic condition is in question. Lurie Children's is the only hospital in the entire state of Illinois that has a pediatric cardiac genetics program. And so we are very pleased to serve families throughout the state and the region. One of the things that makes genetic counseling easily accessible is telemedicine. Because our visits are just a conversation, we can meet with families from their homes when they're safe spaces, when they're comfortable. They don't have to worry about transportation. They don't have to worry about childcare. One of the benefits from being here at Lurie Children's is our partnership with Northwestern. Our genetic counselors here are involved in education for the medical students and residents and fellows and graduate students. And then also we can learn from Northwestern. We want to make sure that while a patient is getting care here at Lurie, that we set them up for success for when they transition to adult care. We want to make sure that they feel confident in their genetic background, that they understand why their condition is or is not genetic, what their future risks are, and then set them up so that they can be fully informed and make educated choices in adult medicine.